Hello and welcome to 72 Dragons Health. Today we have the pleasure of speaking with Dr. Jonathan Kirsch. Dr. Jonathan Kirsch is an internist and hospitalist at the University of Minnesota Medical Center in the United States. He's also an associate professor of medicine at the University of Minnesota Medical School's Division of General Internal Medicine. In addition, he is the clinical director of the Mobile Health Initiative team. His work focuses on medical education, developing programs for underprivileged groups, and researching global health. Dr. Jonathan Kirsch and Chris Newberry, the film director, showcased their film, We Are Here, Lowering Barriers with Mobile Health, at the American Public Health Association APHA annual meeting in 2024 at the Public Health Film Festival. In this 35-minute film, a creative and committed group of medical professionals, aspiring physicians, nurses, community health workers, and volunteers work together to provide essential healthcare services to underprivileged communities across Minnesota. Welcome to this interview, Dr. Jonathan Kirsch. It is an honor and a pleasure to have you with us today.
Thank you. I'm happy to be here.
Dr. Kirsch, what is the Mobile Health Initiative? Please take us through the beginning of this initiative.
Well, the Mobile Health Initiative really began as a response to a really fundamental problem, and that many people in our communities, especially those that are underserved, really face barriers to access healthcare. And we realized that just simply telling people to go to a clinic to get checked out isn't enough. So we've kind of flipped the model. That idea is simple, but it's very powerful, and that's bringing healthcare directly to the community, where people live and work and pray and play, and we started slow and small, and by partnering with local organizations, we really focused on delivering preventative care like immunizations, chronic disease screenings, and substance use support. And the goal is really to support the community by building trust and empowering communities to take control of their own health. There is a crisis currently in the United States in healthcare. We often like to talk about healthcare crises, but right now the crisis we're seeing all over, in measles outbreaks, in mistrust of the health system, and people not knowing where to get information, and people. The trust in public health professionals and public health infrastructure is low, and when it's part of your community, when you are around other people that you trust, and you're empowered to take care of your own health, we're a lot more likely to be healthy, which is what everybody wants. But not everybody knows how to get that information. So that's the general idea of bringing that care to where people are.
Thank you. Very important, because the title of the film, Barriers, so there are a lot of barriers to that. Now, in the documentary, you emphasized the importance of community partners in the success of the Mobile Health Initiative. Could you share who these community partners are and how they help in the success of this initiative?
Well, the model that we use is to partner with communities and find organizations. Often they find us, actually, but partner with organizations that already have trust, and that's sometimes houses of worship. It could be sometimes in the street with organizations that people already trust. People are unsheltered, and in the documentary, we focused on an organization that's in the southern part of Minnesota, very agricultural area, where the children go for their daycare, Head Start programs. And because of that, people already trust that they're taking care of children and they do a really good job. And so our partnering with them allowed us to already have trust.
You mentioned trust a few times. So, and it sounds like these partners in the community provide that. So that facilitates the interaction with the patients in your mobile clinic. Now, you showcased your film, We Are Here, Lowering Barriers with Mobile Health, at the American Public Health Association annual meeting in 2024 in the Public Health Film Festival, and is also available online. What are your hopes or expectations from creating this film production?
The hopes are that we start as a society. This sounds lofty, I'm sorry. But we start as a society to recognize that we have a problem, that healthcare systems are not trusted, and that disease processes, when caught late, are very expensive. They're very hard to treat. And we have an opportunity to reduce the barriers for underserved communities much greater by doing preventative work in communities. And so we were hoping to show an example of how this can be done, and how it can be done in a compassionate, relatively inexpensive way that's also effective. And we highlighted one community. We work with numerous different communities, and if you look at them from the outside, it would be hard to tell how they're similar. East African immigrants and farm workers, people that are unsheltered, people in a mosque, and in a church somewhere, or in a rural area, but they're united by being underserved in a way and having limited access and often limited health knowledge, just because people in general do. So that the hope is, in our healthcare system, we recognize that we do acute care really well, hospitals, emergency departments. We do chronic care fairly well. And in preventive care, at least in this country, we do a very poor job because we're not really doing that outreach. We're hoping that people just come to us. When I say us, I mean the healthcare industry, the facilities. And the reality is that people come late. They come when, diabetes is preventable and sometimes curable. But the complications of diabetes are not. And so we have a huge healthcare industry set up around diabetes, and it's the most expensive disease, at least in Minnesota. It's the most expensive disease per dollar of any of the diseases. It dwarfs the other ones. And yet it's basically preventable. And so how do you do that? You don't do it by continuing to wait for people to come to you, because that's what we're doing now, and it's clearly not working.
Is coming to the patients, coming to their communities.
Right.
Now, in the film, you say, referring to mobile health, it is a disrupted philosophy. What do you mean by that? Can you elaborate?
So disruptive as in like the mobile phone was a disruptive technology relative to cable and wires, because it could be used anywhere and you didn't need to have this infrastructure. And a number of other disruptive technologies change the way we think about an approach. And so we have hospitals, clinics, pharmaceuticals, insurance companies have ways of doing things that work really well for a lot of conditions. Even if we invested twice or three times as much money into those systems, and we already invest an enormous amount as a society, it wouldn't really make it any better for prevention of common diseases that are the most devastating of all, cancer, diabetes, cardiovascular disease. And so thinking about the system in a completely different way, doing preventive care and getting it to where people are, a different philosophy, and it's one that is not currently really embraced by the powers that be because there isn't a lot of money in it. It's very difficult to create an industry that does this, but as a society, I think we need to think about, where do we put our money? Where do we put our efforts? We could build massive new hospitals and clinics and have the same impact that we have now. We could learn from countries around the world that work with community health workers and have broad access to preventative health through trusted sources and using mobile health and making it very low barrier, low cost, low barrier, and making our society much healthier. If we can utilize what we already know and already have, which is that people trust their elders, they trust their community, and partnering and bringing access of knowledge and of small amount of resources can really make a dramatic impact.
Thank you. In the current environment with the opportunities and also with the limitations, how do you see the future of this mobile health initiative?
It's an outside, small endeavor in most places. Everybody does it a little bit differently, and there's not a lot of direction about how to do this right now. We can learn from really the leaders in this area that are with the mobile health map and the family van in Boston and Wayne Health's program in Detroit, and hopefully our small growing program at the University of Minnesota. But we can hopefully learn from those programs and expand the idea of having mobile health really be a core part of the healthcare system, of re-energizing the idea that preventative health and public health is valuable. It is valuable in terms of vaccines and health education, but early detection and prevention is really lacking in this country. And the hope is that this kind of model can really spread throughout the country, as we can show that it can be done in an affordable way and also in an effective way. And that's what's happening. It's a growing movement right now, without a infrastructure, without a payment system, without the big infrastructure that it needs. So it's more of an idea with a bunch of people that are well-meaning applying it and showing that it works. And the more that happens, I think the more that the movement really is going to grow.
Definitely a great opportunity to improve primary care and access to care. Now, Dr. Jonathan Kirsch, thank you for discussing your initiative and film with us. We wish you immense success in future endeavors. And we're grateful to you and your team for working tirelessly to provide healthcare to underserved communities. Thank you.
Thank you.